Hello, welcome to 60 Minutes. Today we will be interviewing Dr. Kevorkian. Welcome, Dr. Death. How are you today?
Thank you for having me on the show. It's really an honor to showcase this event on such a great show as 60 Minutes. I look forward to answering your questions and shedding some light into these issues.
Today we have another very special guest, a soon-to-be patient of Dr. Kevorkian, Mr. Craig Shockley.
Craig has been diagnosed with a terminal illness and is paralyzed from the neck down. He's dealing with this illness and he's done pretty well, but there's no chance of him living for many more years, and he wants to go.
My life's been really difficult these past few years since all I've been able to do is sit in a wheelchair and I have no control for my body from the neck down. There have been many times where I just want to die and move on. It's like not worth the living anymore. I often feel that I'm a financial and I'm just a burden to my family, and I don't want them to see me like this. I don't want to live. This is no way to live life.
And Craig's story is really a game changer for us, and he's a really great patient for us to show that he just wants to die. He doesn't want to live, and he's a very sane man, smart man.
Not just the two of us. What kind of patients come to you?
Well, you see, you have to understand what we're dealing with here. Society and doctors in particular are letting people live and giving people hope. People that don't necessarily need to have hope. People that have terminal illnesses and they really can't live anymore. And they're used for medical tests, and their humanity is kind of stripped away. They really become just test subjects for doctors. So the doctor would come up and tell them, "Oh, you have 5 months to live," and they would say, "Well, maybe you could outlive that. Maybe you could live 2 years." When really that's just giving the patient false hope, and maybe that patient is in tremendous pain during that time. He could just I'm for just being able to, if the patient says he wants to go, he can go.
But what kind of patients are you actually dealing with? Not just doctors. What are you dealing with?
Well, I hear you here, and here's what's going on these days. It's really the doctor's fault. So we've got a lot of patients, and don't get me wrong, I'm a doctor myself, but let me tell you a story. A friend of mine has a daughter, and she's born with an organ outside of her body, and the doctors, instead of telling her parents, this child's never really going to be able to make it in the world, and they gave them false hope. They said, we can fix this, we can make this better. And the story went on, and for months and months, every time she had to get surgery, she got 40 surgeries in her first year on this earth. Every time she got a new surgery, the doctors were optimistic, and it never worked out. And was euthanasia an option? The parents could have been like, okay, at this point, we've got a child here who's not going to make it. She's not going to be normal. We could just euthanize her, and that's the kind of change that we want. We want to be able to change the doctors. We want to take the doctors' strength away a little bit and give that back to the patients. Let the patients decide what's best for them if they're in pain.
Say doctors are only keeping patients alive to test new medications and try to cure them, even though they're still in immense pain. How can we stop them from doing this?
Yeah, that's sure. We can definitely do that. Doctors, what they do is they come down with sentences and they give patients a certain amount of months to live. But what they don't do is they don't really give the patients any options. They tell them, okay, you might die in 5 or 6 months. Get your will ready, get prepared to pass on. And they don't say, you're going to be in immense pain. Maybe you should just decide to, if you wanted, you can choose selective suicide. Like that, you won't be in that much pain. You're going to die anyways. And that's where we need to kind of change that, the power from the doctors to the patients.
What if they can outlive their license, or they have a will to live longer than what they are told to?
Right. Well, this is where we need to really remove the doctors from the equation. You see, the doctors have kind of helped medicine, and they've been very helpful to the advancements of finding new technologies to cure people. And and then their sentences are not always true. But we need to kind of keep in mind the pain factor. If the people aren't in pain, then yes, they can keep on living. But if they're really going to be in pain, if they're going to lose their thinking abilities and lose what they cherish, that's really what the issues are there.
But what are you truly saying here? Is it the patient's decision on whether they get to live longer or not? Because these patients may not even have the right mental capacity to make such a huge decision over their own life.
And that's a really good question. A lot of my critics ask me that question. A lot of doctors also ask me that question. And this is kind of the rule I have. If I feel the patient isn't mentally fit to make that kind of decision, and if the family especially doesn't want him to make that kind of decision, then I won't kill him. Well, and I'm not technically a murderer. I was doing pretty well.
So where did the patient Craig go?
Well, it's a ritual for me to make sure that before they die, we really get them cleaned up, and it's a big moment for them. Obviously, they've accepted that they're going to die, and as you could see earlier, Craig was not doing very well. He was making it through the interview, but he was a little shaky. He was crying a little bit, which is normal. We expect a little bit of emotional unstableness. I mean, as you would expect when you're going to kill yourself. So what we're going to do now is we're going to reconvene where Craig is at in the seat where he's going to die, and he's accepted that. So we're gonna go talk to Craig now, and we'll reconvene over there and finish up the interview over there. All right, sounds good. Look forward to it.
You're checking out all the cans.
Here with Craig, and he's wearing his nicest clothes. He's ready. He spent about 30 minutes kind of getting in the mental, little mental ritual before he dies. So we're just going to turn it over to him, and he's got a few words for you.
Yeah, I think that some patients, this is the only relief that they can get. That they're just suffering so much, and it's just not fair for them to be kept alive by their families who, for their own selfish needs, can't let us go. I mean, it's just not fair to the patients.
I mean, this is powerful, but say if Craig was not in the mental shape to make this kind of decision, or his family was against him making this decision, how would you solve this?
Right, and Craig's family's been for the decision, and again, I want to reiterate that it's really the doctor's fault here, and they've really been oppressing the patients. And so, if Craig was not in mental shape to do it, I would be able to tell. And we just wouldn't go on with the situation. I have had some cases where the family, kind of is against him, committing suicide. But in this case, they're for it, and we're just gonna move on as such.
So you've been saying it's all the doctor's fault this whole time. What are some other choices we could have?
Hard-hitting question here, and it is the doctor's fault. And I'm gonna reiterate that one more time, but. Here's my plan for this. If we slowly, if we get these forms that the patients can sign to say that they're in pain and they don't want to live through maybe some terrible chemotherapy or stuff like that, that's really the way to go. So that's really my plan towards getting that passed and people being an option for people who are terminally ill. And I think Craig, what do you think about that?
Yeah, I agree. This is the only relief I can get, and. I mean, it's just not fair for me to be alive. It's really painful. I'm in a lot of pain a lot of the time, so it's tough. If I were just paralyzed from the waist down, I could live with that, but only being able to move my head around is not really a life to live.
And he also has a terminal illness, let's not forget.
So, Craig, would you agree that this is mainly the doctor's fault?
Yeah, I would say that this is
Before he really starts to really answer this question, I just want to say one more thing. We really need to educate people. Being a doctor myself, I've seen a lot of people live for years with like mushrooms in depression, knowing that they're going to die and just having no will to live. And that's really what we're doing here. We're giving people a chance to move on. And I think, Craig?
Yeah, I mean, it's definitely better to move on and just relieve the pain. And as I've said before, and I can't express this enough, it's just not fair to the patient. I mean, if you had to live this life, you would be begging for death, and day after day having to be spoon-fed, and you can't even go to the bathroom, shower by your.
So now we're just gonna do the deed. And Craig, are you ready?
Of course.
Do you have any famous last words?
No, I've been waiting for this moment my whole life.
Okay, well let's.
Ever since I got my disease.
Okay. Well, here it goes.